All right. Welcome, everyone. We're going to go ahead and get started. My name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. Thanks for joining us for another segment of Numbers with Nick. We're going to talk about our metrics, and you may have heard some recent news that we are going to be retiring our Rock County Public Health Department reopening guidance for the public on June 8th. And today we're just going to talk about some of the data related to that decision-making process and give you a sense of where to find that information. Also, the State Health Department has indicated that they're making some changes on their website with respect to the data that they provide. So I wanted just to let everyone know about those changes that they're making. So just to let you know, before we get into the content for today, if you do have questions as we're going through, feel free to put those in the chat box and we'll try to answer those at the end of the stream. As always, if you do have questions for us after the video is concluded, you can always reach out to us via social media and we'll try to get back to you as soon as possible. So with that, I just wanted to show you where you can find the Rock County reopening metrics. So I'm here at our Rock County Public Health Department homepage. You can see the URL at the top of the screen. So it's co.rock.wi.us/publichealth. And then front and center, we have our nice coronavirus image. If you click on that, you'll be taken to the COVID-19 homepage. And when we look at our information, you can scroll down. We have lots of information on our homepage related to COVID-19. The section that we're going to be visiting today is under the data. So we'll click the data box. That will bring us to all the different data reports that we have related to COVID-19. And the specific dashboard that we're looking at today is the Rock County Reopening Dashboard. So historically, we had updated this dashboard on a weekly basis. And now that we are retiring our reopening guidance, we will be moving to updating this report every other week. So although the reopening guidance is going away, we want to make sure that people are aware of some of the data that we're still tracking with respect to the pandemic. So without further ado, I'm going to jump into the reopening dashboard and just kind of talk through some of the metrics that we have been tracking over time and some of the positive changes that we've seen most recently that led to the decision-making to retire some of the guidance. So when you open up the report, the first couple pages provide kind of an overview of the metrics. We're using kind of a stoplight system of red, yellow, and green. Green indicating that the metrics we're doing well. Yellow meaning that we should be a little bit cautious, and red means that things are not looking good in the county based on the data. And we have all of the different metrics here on the left-hand column. We have some text here indicating kind of why we chose these metrics to include as part of our reopening decision-making process. And then we also provide some information about the breakdown of the different levels and when we may move from like a red to a green or something like that, and how those data thresholds are set up for each of the different metrics. So I'm not going to spend too much time going into the text, but just wanted to give you a brief overview of some of the data that we've seen over the course of the pandemic and where we are and why things are looking pretty good right now. So the first piece of data that we look at is percent positivity per test. And I know that we've talked about this on previous videos, but just wanted to give a brief definition of this. This is basically, we look at all the people who have tested positive in a 2-week time frame. So this 2-week time frame most recently is between May 19th and June 1st. And then we also look at the total number of people who are being tested in that time frame. And then we come up with the percent positivity, which is the percent of the total number of tests that are being administered that come back positive. The reason we use this metric is that it tracks a couple different data points at the same time. So it looks at the number of new cases that we're seeing in a specific time period. And it also keeps track of how much testing is occurring locally. And by combining those into our positivity rate, we can get a sense of if we're seeing increase or decrease in our case activity and increase or decrease in our testing. We want to make sure that there's adequate testing in the county so that we're very well aware of where COVID-19 is in our community so we can protect people and prevent the spread of the disease. So right now, over the last 14-day period, 3% of the total tests that have been done in Rock County have come back positive. And this number is very low. Our benchmark is less than 5%. The CDC says that 3% or lower is even better. So we have seen a pretty steady decline in our positivity rate since about mid-April. And before that, we were very low. This graph at the bottom of the page just tracks the positivity rate over time since last June. So you can see how the positivity rate has changed depending on where we were in the pandemic. So in the months between kind of October and December, and even in January, we saw a lot more COVID activity than we wanted to see. And our positivity rate was as high as about 16% at kind of the peak of the pandemic. Most recently, we're at 3%, and we've kind of hovered between 3 and 5% over the last couple months, which is great. And I expect we'll continue to see pretty low positivity rate as we get more and more people vaccinated in the community. So I did mention this already, but testing is an important data point that we want to keep track of when we're making sure that we're well aware of COVID spread in our community. We want to make sure that there's adequate testing based on our population size. So at the beginning of the pandemic, we decided upon 240 tests per day over a 14-day period was adequate testing. And this metric was determined based on some research that was done by Harvard Medical School in terms of how many tests needed to be done based on population size to make sure that we were well aware of what was going on in our community. So most recently, we have averaged about 376, almost 377 tests being done per day over this 14-day period. We are seeing a slight decrease in terms of our total testing being done. You can see the graph at the bottom of the page shows the number of total tests that have been administered on a 2-week basis. And we're seeing a decline since mid-April, but that's not too concerning at this point based on the low levels of COVID activity that we're seeing in our community. So we probably will expect to continue to see testing levels decrease. There is still testing widely available in Rock County. So if you feel like you need to be tested for COVID-19, you're more than welcome, and we encourage you to get tested. But we probably will see some decreases in testing because we'll see fewer people who are having symptoms because there's just less COVID going around in the community. The other metric that we took a look at is the number of new cases among healthcare workers. And the important point about tracking this piece of information is we want to make sure that we're not in a situation where we're limited to caring for our COVID positive patients because we don't have enough healthcare workers who are healthy and able to care for those patients. So we've been tracking over the course of the whole pandemic how many healthcare workers have come down with COVID. And we want to see no more than 5 healthcare workers testing positive in a 2-week time period. This ensures that we have adequate healthcare staff to treat the patients that we're seeing, not only for COVID-19, but for other health issues in our community. Most recently, in the last 2 weeks, we've seen 1 case among a healthcare worker, and we have seen kind of ongoing decreases, especially since the vaccine was first introduced. It was made eligible to those frontline healthcare workers. So since that time, we've seen very few cases among healthcare workers. We've seen some slight upticks depending on the time. And also, we're including healthcare workers kind of as a general definition. So when we talk about healthcare workers, this could be workers who are at a skilled nursing facility or a nursing home who are providing care to patients. The next set of metrics that we look at is based on our hospital resources and our hospital capacity. We've been tracking the kind of the bed availability at all of our major health systems across the county. So to date, in this last 2-week period, we still are seeing a little bit of strain on our healthcare systems, but we have determined that this isn't due to COVID-19. This is due to other patients who are needing treatment. And so because our COVID-19 cases aren't greatly stressing our healthcare resources. Although this metric is currently in the yellow, it was determined that the other metrics kind of showed a pretty positive outlook in terms of our healthcare resources that are available for our community members. So the other metrics that we're looking at are our bed availability and our ventilator availability. So it's really important that we have plenty of space in our hospitals if we do see an increase in our COVID patients. And so the goals that we set out kind of at the beginning of our reopening plan and our reopening dashboard were we wanted to see at least 35% of ICU beds available over a 2-week period. And we wanted to see more than 50% of our ventilators available over a 2-week period. Right now, we are exceeding those metrics, and we have been exceeding those goals for the past few weeks now. So the trends are looking good in terms of our hospital resources and bed availability. Additionally, we're tracking staffing levels and staffing status at our hospital systems. We do have one of our 4 healthcare entities reporting that they have some critical staffing shortages. But again, these shortages are not due to COVID-19 patient influx. It's more due to other factors, including other patients needing care. So at this point, this metric was not overly concerning in terms of being in the yellow versus green because of the other metrics that we were just talking about, and also from kind of reports that we're getting from our healthcare partners through ongoing communications. Thankfully, we have not really seen any kind of critical supply lacking in terms of the entire pandemic. We haven't been in a situation where we're lacking critical supplies like gowns or masks or ventilators for the sick patients and our healthcare staff. There were certain places across the globe as COVID kind of picked up and became more widespread. We were seeing instances in healthcare systems where they didn't have masks or gowns or other kind of safety measures that were needed to provide support for those ill patients. In Rock County, we have seen kind of no indication that there's been a limit in our critical supplies needed to treat ill patients. The other metric that we're using is related to our contact tracing. So contact tracing is a very important tool that we use as a health department, not only for COVID-19, but for a number of other communicable diseases in the community. The idea is we want to make contact with people who are testing positive as quickly as possible and make sure that they have the right information to protect themselves and prevent the spread of the disease to their family members, to their friends, and to other community members. So the way that we're tracking this information is making sure that we're reaching out to those who are close contacts with confirmed cases in a very short time frame. We want to make sure that we're contacting people within a 48-hour window if they've come in contact with a confirmed case. The reason is we want to make sure that anyone who's had close contact with a confirmed case is protecting themselves and monitoring their symptoms to make sure that they're not coming down with COVID and potentially infecting others. So right now, our goal is to reach at least 75% of the close contacts that have been identified to the health department within 48 hours. Most recently, we've been able to reach 83% of those close contacts within 48 hours. We do include some other information. Obviously, it's very important that we're making contact with our confirmed cases as well. And so I invite you to explore the other data that we have related to our contact tracing efforts locally. Finally, the last metric that we're using is reports that come from our healthcare systems, but it's based on the number of people who are showing up to their doctor's office with COVID-like symptoms. So these aren't necessarily people who have confirmed COVID-19, but rather the symptoms that are pretty consistent with COVID-19 infection. We want to make sure that we're seeing fewer and fewer people who are presenting to their healthcare providers with these types of symptoms. That indicates to us that even those cases that aren't being identified by a laboratory test are going down. And so we're seeing a decrease of the burden of COVID across the community. Thankfully, we are seeing very, very low numbers of people presenting to their healthcare provider with COVID-like symptoms. Over the last couple of weeks, we are on a downward trajectory in terms of our trends. But also as we look at the whole scope of the pandemic and these numbers reported over time, we're seeing, similar to our COVID activity, a pretty steady decline since mid-April. So those are the metrics that we were using in kind of determining our reopening criteria and moving from phase 1 to phase 2 to phase 3. And ultimately, we saw plenty of evidence that we had prolonged kind of positive outlook in terms of the metrics that we were tracking related to the pandemic. And that kind of precipitated the decision to retire the phased reopening guidance. I think we're at a place where we really need to focus on getting as many people vaccinated as we can. The other protection measures are still important for those who are unvaccinated. So mask wearing and social distancing is still going to be important if you haven't gotten vaccinated yet. And we really are stressing the importance of just getting vaccinated, and that's going to be kind of our route out of the pandemic. So with that, I'm going to switch gears a little bit and take a look at some of the data that the state is now providing. So they made an announcement just recently that they're working on some ongoing data cleanup and presenting information in a different way that tries to limit the how the data kind of seems to bounce around from day to day based on data cleaning and data quality issues. So with any kind of communicable disease, we do get reports from our laboratory partners, but these reports aren't always complete in terms of when this person tested positive, when this person first had symptoms, all those kinds of things. It takes a little bit of time to get that information. So we may know that they tested positive, but we don't necessarily know when their symptoms began. And those kinds of things sometimes complicate how we report our metrics, and the state certainly is experiencing or has experienced that issue. And so they've put some significant resources towards cleaning up the data and trying to update the way that they report the data so that we get the most up-to-date real-time counts of the disease, but also we're not seeing kind of some issues related to data cleanup. There have been some instances where there are, between one day to the next, there are like negative number of positive cases. And so how can that be? It's because there are some issues with how those positive cases were reported. Sometimes the probable cases that are reported from a laboratory get counted as a confirmed case instead of a probable case. And so some of those issues we're trying to avoid, and the state is trying to avoid, and changing up how they're presenting some of the information. So with that, I've kind of pulled up a couple of the state websites where they have updated their dashboards and their metrics and the data visualization that they have. So the first website, you can see the URL at the top of your page, but this is kind of the summary picture of COVID-19 in Wisconsin. So what they have included on this dashboard is case activity. So they've included the number of counties that are seeing high case spread of COVID-19 currently, and the number of counties that are seeing medium case spread. Now, as we continue on through the pandemic and more people are vaccinated, I expect we'll see a box to show up that says low case spread and the number of counties in Wisconsin that are experiencing low case activity. They've also included the percent of residents who are vaccinated, either with at least one dose of the vaccine, and the percent of residents who have completed the vaccine series. And the new way that they're reporting some of this information is in terms of 7-day averages. So you see under all of these metrics in the middle of the page that these are now reported as 7-day averages instead of a daily count. And the reason they're doing this, again, is to address some of those issues and fluctuations of day-to-day changes and data quality issues, and trying to give you a sense of what the trends are over the last 7 days, which smooths out some of those fluctuations. So they include information about the number of new confirmed cases in giving you a 7-day average. Also the new probable cases. So there are certain instances where people have symptoms that are consistent with COVID-19, but don't necessarily get a confirmatory test to show that. So that's also important for us to track. And then the percent of total tests that are coming back positive, and that's the positivity rate that we mentioned earlier that's included in the Rock County reopening dashboard. They also include some information about the total confirmed deaths due to COVID-19. Deaths due to COVID-19 is a tricky subject because oftentimes we're seeing deaths in the elderly population and among people who have lots of kind of comorbid health conditions. So it's a little bit tricky when we're in this pandemic to sort out what deaths are truly due to COVID and which ones are potentially COVID related, but not necessarily directly caused by COVID-19. So we have some information in terms of the total confirmed deaths due to COVID, probable deaths that are due to COVID, and then they're also including the 7-day average of new deaths being reported to the state. And the graph here also includes data related to the kind of the change over time that we've seen in the number of new deaths that are being reported to the state. So that's one example of some updated dashboards that the state has put together. The updates that the state is going through won't necessarily affect the data that we're reporting locally in terms of all the reports that we have on our Rock County Public Health Department website, but just wanted to make you aware of that information if you're interested in seeing some of this information that the state has put out. The next page, and it's going to reload here just briefly, is related to disease activity tracking based on county. Some of this information is very similar, so I won't go through the specific information, but again, this is another dashboard where some of the updates that the state is working on will be reflected in this page as well. And this page is nice because you can see the metrics that are related to every county in the state. So Rock County being down here on the southern border of Wisconsin, you can see the data when you mouse over the county. You can also click on the county, and you can also use this drop-down area to filter out the data just for Rock County. So the state is still classifying Rock County as an area where we're seeing high COVID activity, and this is based on some thresholds that they've set out in terms of the number of new cases per 100,000. So we have 111 new cases per 100,000 over the last 2 weeks. We are seeing a pretty strong decrease in the number of new cases that are being reported to the health department, the number of new people who are testing positive, but we want to continue to see those numbers drop. Right now we're averaging about 6 to 8 new cases per day over the last week. And it'd be great if we continue to see that drop to levels of 1 or 2 new cases per day being reported to the health department. So again, I invite you to explore the new pages that the state has put together and the new data that they're putting out there. And as I said, this won't greatly impact the data that we're providing on our Rock County Public Health Department website, but wanted to make you aware of some of those changes. So with that, I'm going to take a quick look at the chat and see if there have been any questions that have come through. Let's see, no questions. Okay, so with that, we're gonna close out for today. But I just thank you all for joining us for another Numbers with Nick segment. And if you have questions, you can always ask on social media. With that, we'll be joining you in another couple weeks. So stay safe and healthy, everyone. Thank you.